Hi, welcome to PK's classes. Today we will study ACE inhibitors. ACE stands for angiotensin converting enzyme. So ACE inhibitors as antihypertensive drugs today we will study. In the antihypertensive class we have studied how this renin angiotensin system acts. We know angiotensinogen, which is an alpha 2 globulin, a plasma protein. It is a plasma protein. It is released from the liver, and this angiotensinogen is an inert peptide which is converted to angiotensin 1 by the action of renin enzyme, and this renin enzyme is released from the juxtaglomerular apparatus present in our kidney. So this release of renin from kidney is beta 1 receptor mediated, and this renin converts angiotensinogen to angiotensin 1, and angiotensin 1 is a decapeptide with 10 amino acids, decapeptide, and this decapeptide is converted to an octapeptide angiotensin 2 by the action of angiotensin converting enzyme. ACE stands for angiotensin converting enzyme. So this ACE converts angiotensin 1 to angiotensin 2, and angiotensin 2 is again can be converted to angiotensin 3 in the adrenal gland, which angiotensin 3 is a heptapeptide and it has action on the adrenal cortex. So AT1 receptor, angiotensin 2 receptor is of two types, AT1 and AT2 receptor. AT1 receptor is present in the adrenal cortex and the blood vessels. In the blood vessels, the action of angiotensin 2 is vasoconstriction. So vasoconstriction increases the peripheral resistance, and in adrenal cortex it increases the secretion of aldosterone. So aldosterone causes the salt, sodium and water retention, which increases the blood volume. So blood volume, increase in blood volume increases the blood pressure, and increase in peripheral resistance also increases the blood pressure. As we know, blood pressure is equal to cardiac output into peripheral resistance. So when the blood volume increases, the blood pressure increases, and when the peripheral resistance due to vasoconstriction increases, so the blood pressure also increases. So ACE inhibitor means these drugs will inhibit this enzyme. ACE inhibitors. Okay, for example, captopril. So these drugs end with pril, captopril, enalapril, lisinopril, fosinopril, benazepril, moexipril, quinapril, ramipril, trandolapril. So all these are ACE inhibitors, example of ACE inhibitors, and by inhibiting ACE, these drugs can reduce the blood pressure. So they can be used as antihypertensives. Then this ACE is a kinase 2 type of enzyme, and this kinase 2 is involved in this kininogen, another inactive peptide. Kininogen is converted to kininogen is converted to bradykinin by the action of the enzyme kallikrein, and this bradykinin is a nona peptide. Nona 9 amino acids are there, nona peptide, and this bradykinin is itself a vasodilator, and also increases the prostaglandin synthesis. So vasodilatation means it can reduce the peripheral resistance and also decreases the blood pressure. So bradykinin. So bradykinin is degraded by kinase 1 to des-Arg bradykinin, and des-Arg bradykinin again degraded by kinase 2, which is similar to your ACE. ACE, angiotensin converting enzyme, is a type of kinase 2 enzyme, because we can see in this case from a decapeptide it is converted to an octapeptide. So 2 amino acids are lost, and this kinase 2 is there is also loss of 2 amino acids. So ACE, we can say that ACE, in addition to that conversion of angiotensin 1 to angiotensin 2, also helps in degradation of bradykinin. Okay. So when we use ACE inhibitor, so in addition to this renin-angiotensin system, this ACE inhibitors also inhibit the degradation of bradykinin, and in that process they also help in reducing blood pressure. Okay, and this bradykinin accumulation causes irritation of bronchial smooth muscles. So this causes dry cough. So the ACE inhibitors has a major side effect, that is dry cough, and this vasodilatation also causes edema, angio-oedema. So the side effect of ACE inhibitors occurs because of inhibition of this this system, this kininogen bradykinin system. So there will be side effects like dry cough, then angioedema, and also blood pressure below normal also occurs. So there will be hypotension. Hypertension may also occur. So accordingly dose should be adjusted. But the major drawback is this dry cough, and because of which these drugs are nowadays not preferred, and these drugs are replaced by the angiotensin 1 receptor blockers. Okay. So if we go to the use of ACE inhibitors, in addition to their use as antihypertensives, they are also preferred in people with high risk of ischemic heart diseases, myocardial infarction, and diabetic nephropathy also. So hypertension and diabetes, these drugs are preferred, and in case of progressive renal insufficiency, these drugs are preferred. Okay, so in kidney disease also these ACE inhibitors are preferred. Okay. However, because of these the side effects of these drugs, because of the side effects, mainly dry cough, these drugs are not preferred nowadays, and they are replaced by AT1 receptor blockers. Thank you.